Everyone, this is Dr. Bhupesh from Dr. BKM OET Institutes. And today, this lecture is a very small lecture about what is important when it comes to OET speaking. See, guys, OET speaking is all about nurse patient or doctor patient interaction. Even if you are a pharmacist, then it is about pharmacist and patient interaction. So the first and the most important thing to get maximum marks, first and the most important thing to get maximum marks is to have the right interaction. Right interaction means if patient is asking something, you need to respond to that problem. You can't ignore. You can't say, oh, this is my fifth point. I have to talk about second point first because I'm on the first point. No, you have to break the sequence if patient breaks the sequence. Suppose if patient asks you in between, oh, nurse, I don't care. I just want to know about the treatment. But your role play says that you have to discuss about the causes. So then you will say, I'm really sorry. Before talking about the treatment, I need to understand what is causing you this problem. Because treatment also means prevention. So prevention means that I need to know what is the triggering factor. So if you will tell me what is causing this problem, what are the triggering factors, then obviously it would also be the part of treatment plan. Again, let me explain you. Means you don't have to make it that difficult. If your English is good, then you obviously you can speak like me. But if your English is normal, then you say, I am really sorry. Before I can explain you about the treatment, I need to understand what is causing this problem. Because in treatment, we also need to, kind of subside what is causing the problem. So we need to understand what is causing the problem. So treatment plan also includes to avoid these kinds of triggering factors. So are you understanding my point, Mr. John? So then he says, all right, nurse, okay. Thank you for understanding, Mr. John. So OET is all about this thing. Thank you for understanding this, Mr. John. So could you please tell me any triggering factors that you have noticed? This is what gives you 450 marks. When people say how to score 450 or 350, I'm not talking about 350. This is where you have to break the sequence. You need to understand. And breaking sequence again, I did not break the sequence. I said, I'm sorry, I cannot tell you about the treatment plan unless I understand what is causing this problem. Because first of all, we need to understand the triggering factors. And then in the treatment plan, eliminating these triggering factors would also be part of the treatment plan. So are you getting my point, Mr. John? So if you don't mind, can you please tell me about the triggering factors that you have noticed? Then so you get to the next level of OET speaking. That is what OET speaking. So the maximum marks is of patient nurse or patient doctor or patient pharmacist or patient physiotherapist interaction. So if you are a pharmacist, if you are a doctor, if you are a nurse, it is important to satisfy the patient. That is what you get. Even in OET speaking, that's what I say. Grammar problem, if not the repetition of a particular thing, but if you take four or five, if you make four or five grammatical mistakes, still you can get more than 400 in OET speaking only. Writing four or five grammar mistakes means you are in trouble. But in OET speaking, if you are having four or five grammar mistakes, still examiner will see that whether you made the patient happy, you made the patient satisfied. So he would be covering these points. Important lines, what I can say important lines is, do you understand? Oh, sorry. Have you understood, Mr. John? Asking in between. So whenever you are discussing about a treatment and there is a lot of things that you have told, or maybe you are talking about the disease. Suppose if you're talking about the diabetes, you say, see, Mr. John, diabetes is basically one of the condition that happens due to the raised blood sugar levels. And that happens majorly due to due to the problem that happens with our insulin. Insulin is one of the hormones. So now you have spoken too much for the patient. So then you say, are you getting my point, Mr. John? Means you try to, it is very important. Are you getting my point, Mr. John? It is very important. Or Mr. Rohan, doesn't make a difference. So you take the name of the page. Are you getting my point, Mr. Rohan or Mr. John? So that is very important. So are you getting my point? Have you understood everything? And these you can use at different points, not at the same point. Are you getting my point? Okay. Then Mr. John, proceeding further. So you go, then proceeding further. Let me tell you more about this. These are the things. Let me tell you more about this. Remember this line, write these lines. Write these lines 10 times. If you are having problem in speaking, write these lines 10 times. Let me tell you more about this. So once you have told, then you talk more about this. Then you say, okay, have you understood everything? After the completion of a particular thing, now suppose you have explained everything about the condition. Then you say, have you understood everything, Mr. John, or should I repeat anything? So it's better to say, are you getting my point? When you are asking in between, are you getting my point? Okay, then proceeding further, let me tell you more about this. Have you understood everything or should I repeat anything? That is the things which are very, very important to interact with the patient in the best possible way and to gain maximum marks in OET. Then guys, you can think about more things. Asking questions is a very good ability in OET. Very good ability. And this is also asking questions. Are you getting my point? Most of the questions in OET would be, of course, related to do. So you ask the patient, do you smoke? Do you drink? So normal lines. Do you smoke? How many cigarettes do you smoke? Do you drink? Okay. How much do you drink? Please remember these lines. With drink, you say how much do you drink? With smoke, you say how many cigarettes. So many. Many with cigarettes and much do you drink? When there is any injury to the patient or any migraine, anything, then best is when did it start? When did it start means when did you notice it for the first time? Very nice way of asking. Suppose the patient is talking about headache. So could you please tell me when did you notice it for the first time? Okay. So is it continuous or intermittent? Asking question like these. Very, very nice. So the best way of asking is again, do you smoke? Do you drink? Then this is superb. Did plus first form. Examiner will give you marks like anything. When did it start? When did you notice it for the first time? If there is any accident, anything like that, how did it happen? You get marks. Did plus first form. So then again, simple questions, family history, asking about this, put it in the category of do. Do you have any family history regarding the same condition? That is way to get marks. Please write these lines 10 times each. Practice them in front of mirror. Keep talking about it. So do you have any family history regarding the same condition? Did you suffer from this condition in the past as well? So family history should be asked afterwards. First of all, I should ask about the personal history. So did you suffer from this condition earlier as well or in the past? Condition from earlier as well. So that is the way. So did you suffer? You will get marks like anything. Or otherwise, like, do you have any past experience regarding the same condition? Okay. Do you have any past experience? Do you have any family history? So I will put, do you have any family history? Or do you have any past history regarding the same condition? Do you? So these are the way to ask questions. Then most of the people, again, to get complete 350 points, if you are weak at speaking, then if you have remembered, if you have learned these lines and you spoke these lines, then obviously you will get 350. The marks that you will get is again in the end. Okay. So when you explain everything to the patient, you'll say, okay, now I would like to, now I would like to repeat, or I would like to highlight the key points of our conversation again. For simple, I would like to highlight the key points again. Mr. John, you are having diabetes. So try to explain whole role play in just 2 seconds, in just 15 seconds. Okay, you are having diabetes, and so you need to take precautions. Take precautions. We have discussed about all the precautions and all the treatment plan. Hope you are satisfied. Hope you are satisfied. Patient will say yes. Okay. Then please follow these instructions. And here is, and I'm giving you a pamphlet, or here is the pamphlet, whatever you want to say. And I'm giving you this pamphlet, a pamphlet that has all the instructions, all these instructions in the written form. Please follow these instructions. And for any doubt, you may contact us anytime. See, I'm writing on the laptop, being a medical professional, being a doctor, I'm writing in front of you all. It doesn't take time. Practice does not take time. Thinking and wasting time is far more difficult than practicing. Don't waste time. Utilize your time. If you are having problem with speaking, here is the speaking video of only 10 minutes. Write everything 10 times. Try to speak and learn. Last thing about the speaking, I'm talking in the last, but it is the first thing. Whether asking name of the patient is important or not. Asking name of the patient is again depending upon the role play. Suppose if you are on a help desk, OPD, patient has come to you. Say, good morning, my name is Bhupesh. I'm a nurse over here. How may I help you? Well, nurse, see, I'm having this problem. Okay, I need to, before I can help you, I need to, I need your name. Or before I can help you, could you please tell me your name? All right. My name is Mr. John. Okay, Mr. John. Now you talk about the same thing. Okay, Mr. John, you were saying that you are having headache. Am I right? So that is how you say. So how may I help you? Mr. John will say, I'm having headache, this and this. Okay, before I can help you, I need to ask your name first. Could you please tell me your name? Then patient will say, okay, my name is this. Then you will say, okay. Then Mr. John, in that case, you were saying that you are having headache. Am I right? So how long have you been this headache? When did you experience it for the first time? Is it continuous? Is it intermittent? Okay, Mr. John, I'm recording all these things. I'm noting down all these things. Okay, so I need to ask you a few more questions like, do you smoke? Do you drink? And did you suffer from this condition in the past? Okay, do you have any family history? Okay, and then, then, okay, Mr. John, let me explain you about things, this and that. Then you talk about things and you talk about the whole thing. But if patient is already in the hospital. So obviously you must be knowing the name. So you can simply say, good morning, Mr. John. How are you feeling today? So you can presume the name. How are you feeling today? If name is given, that's best. In the task where patient is already admitted, I think name would be given. But if name would not be given, then you can assume the name. So good morning, Mr. John. And so how are you feeling today? I have got your results. I have got your reports. And I would like to tell you that you are better. That you are having this and this condition. So means you just start talking about the role play straight away. So these are the various ways of handling OET speaking task. Then there is one more thing. Suppose if patient is coming to your clinic, he has already visited and he is coming for the test reports. So again, you can say the same thing. Good morning, Mr. John. How are you feeling today? So we have got your blood test reports and reports show that you are having this and this problem. So that is about OET speaking. Please love this video, like this video, hate this video, but write all these point 10 times. Speak in front of mirror. At least you would be sure that one role play or one module is done completely in the best possible way. This is Dr. Bhupesh once again from Dr. BKM OET Institutes, assuring you for the best OET coaching. Our number is 76967 34256. Thank you very much.